back pain. There's a good chance you have it or you know someone that is dealing with it. There are many things that can cause pain on the backside of our body to occur, and the mechanisms that cause pain, abundance. But it can be something that's acute, whether you fell, whether it's an exercise you did wrong, or something that's chronic, whether it's the environment you work in, a daily task that you do consistently day in and day out, and your body's just trying to protect itself. So we may become stiff there, or we may develop pain. Here are a couple different things that you can do to hopefully alleviate some of that pain and get you moving in the right direction. So we're going to start by moving the spine. How many times a day do we actually move our spine? I want you to start with the simple cat camel, and all that's going to be is we're going to try to start this movement from our lower back, that pelvic area, and I want you to think, turn your pelvis underneath you, almost like trying to point your butthole to the ground, and then from there you're going to walk up your spine and trying to bring it to the ceiling, but you're actively pushing your hands away and trying to take your scaps and reach around your body as you push. So you're trying to create this big oval, this big opening on the upper side of your back as you push the ground away, tuck your chin, and try to open everything up. We're going to reverse direction on our way down. We're going to fall into our hands, slowly go into an extension of our lumbar spine, and we're going to opposite now turn our pelvis into that anterior pelvic tilt, trying to point it up to the ceiling. And then we're going to reverse directions. Pelvis turns underneath us, tucking our butthole, pointing it to the ground, start segmenting up our spine, pushing the floor away, tucking our chin, holding that open, then reverse. Chin starts to go up, we fall into our hands, we start walking down our spine, pointing our butthole up in the air. We're going to look for about 8 to 10 reps of those, slow and smooth, something that we can do daily to kind of get that hydration pump moving in that spine, get that fluidity going, get some movement occurring. Now that we've moved our spine in that cat camel position, we want to work our way up and kind of open that T-spine up. I think far too often than not when we feel pain, we're like rush to it, address it. Whereas if we can address some of the things around it and get things to move better, we can open up that area and alleviate some of that tension. So we're going to start from this seated back position, and we're just going to have our hands flat, and we're just going to open up and follow our hand. Might feel your back crack a little bit, feel some of that air release because we haven't done something like this, but rotation is good. We should influence rotation, and we should want to do it daily to keep us moving. Take our daily movement vitamin. We're just going to get like 8 each side. Nothing crazy, just kind of opening up. If this is too easy, we can kind of go up to a quadruped position, and we can kind of add another dimension of like reaching in and then opening up. But since there's this block, it's going to restrict some movement. So we'll just start back here, and then you can progress forward as you need it. But let's think about 8 to 10 reps each side, and we're just opening that spine up, reaching, alternating sides. So now that we moved our spine, I love to get the hips moving. So we're going to do 8 to 10 rocks each side from a Shin Box rotation, using our hips to kind of guide that, or our hands to guide that movement as it kind of keeps our posture upright, and we get to use this hip as the hip it is, the ball and socket joint. We're getting it into internal and external rotation. I found that sometimes when we can get this hip to do the right thing, it alleviates some tension going upstream. Because remember, it's not our body's job to do the right thing, it's our body's job to do the laziest thing. And our body's going to always ask other parts of our body to donate stability, especially if we're experiencing pain or maybe have a restriction of movement. So by getting things to move around a localized spot, you may be able to release some tension and may start to get some comfort, whether that's mentally or actually physically. But just 8 to 10 reps each side, working that shin box position, moving throughout internal and external rotation of the hip. Tension can often be the cause of when we experience pain, that sensation of feeling that tight feeling that we may be experiencing. I love this setup, especially for my guys that are traveling often, because they can do it while they're driving. They can even do it in an airplane, but it's just something as simple as putting your leg up over. You probably feel some comfort if you're sitting for a long period of time to go into this position anyway. But from this setup, we can allow our body to kind of fold into it. You'll feel that stretch in your glute, kind of relieve some tension, and maybe even push back away sitting up nice and tall. kind of fold into this spot, grabbing your knee, maybe pulling it up to you, and then pushing your knee into your hand, feeling that glute get a little contracted, maybe feel a little bit of stress there, and then kind of relieve and sit back up. We can alternate legs, kind of giving us make sure we do both, giving us a different feel, but at the same time, I'm just easing into it. Don't force anything here, but ease into that range. And if you're looking for an added, like, I'm not feeling this as much, I need more, wrap your hand around, push your knee into your arm, you'll feel that contraction occurring and you providing some added resistance. But you might notice something as simple as sitting, maybe doing some prying on this knee, folding, kind of exploring around with your hip, alternating sides. You might feel like, wow, my lower back feels a little bit loose just because we got some glute involvement, some tension around that hip joint to kind of loosen up a little bit. So maybe it's not donating so much stability up to that low back, locking things down. So remember, with the lower back, tension can be a big issue. So why would our hamstrings play a part in low back pain? Well, if we have a lot of tension along this backside line, it's going to throw off what's going on with the pelvis. And as we move that pelvis through those other movements, we can notice that that can play a part into what's going on with our lower back. So let's kind of get into some hamstring rocks. So I like to stretch the groin now. We get some separation between the thighs for the pelvis, but most importantly, walking those hands back, pulling those toes up, feeling that tension across the hamstrings, and then rocking forward. And we're just kind of using our hands to kind of guide this position, pulling that toe up, feeling that tension across the hamstring, and moving. We're not staying in a position long enough to have some deep static stretch. It's more of feeling that stretch, feeling that tension, and moving in and out of it. And we're just going to get about 8 to 10 reps each side for each leg, kind of moving in and out, separation of the thighs, pulling up, feeling that tension, moving away, just playing with tension along the backside to hopefully alleviate some tension moving up towards that lower back. When it comes to the lower back, we don't want to just move it. We also want to create some strength. We want to create some stability so our body can organize a little bit better instead of defaulting to maybe patterns that cause us pain or maybe the thought of pain, and it's all in our head. So let's start out with something very simple from a core perspective, a plank. Elbows about shoulder width apart, getting into this plank, and I'm squeezing my butt, trying to force my pelvis underneath me, pointing my butthole to the ground, and I want to think flat back, relaxed neck, big inhale, forceful exhale through the mouth as you get tighter. Big inhale, forceful exhale. Big inhale, forceful exhale. Basically, I'm trying to create as much stress and tension through the abdomen of my body to kind of create some strength, some confidence of what's going on. Remember, anterior flexion prevents passive extension. So when we're holding movements like a plank or other movements where our torso needs to be involved, we need to be active with flexing this so we do not default to passive movements. But remember, big inhales, forceful exhales, getting tighter each rep. So we haven't talked much about the hip flexors, but here's a simple exercise to address the tension relationship that the hip flexors may be causing on your lower back because the psoas specifically connects there. So a dead bug movement. We're going to start flat on our back, arms and legs straight up in the air, your head's on the ground. Think double chin, like you're taking a bad picture. Double chin. I want arms up. Let's just keep our arms straight up. We don't need to move them right out the gate. So from here, I'm thinking dropping one leg at a time, but I like to exhale on the drop because that's involving my diaphragm, some breath work, and that's exactly where that psoas is. Exhale. Inhale, bring it up. Alternate sides. Exhale. Inhale, bring it up. Exhale. And as we're holding that exhale and we're dropping down, I'm not allowing my lower back to come off the ground. I'm keeping my pelvis underneath me, which is creating more tension on the front side of that hip. So if we're experiencing lower back pain and you're doing this wrong, you may be contributing to the problem. Make sure you keep your lower back on the ground, and if you can't reach all the way to the ground yet, that's okay. Exhale, maybe regression, stop, inhale, bring it up. Maybe we even have to bend a leg. Exhale, regression, bring it up. We're getting about 8 reps each side, but remember, I'm just trying to strengthen what's going on the front side of my body so I don't default to those extended patterns.